Hello, everybody, and thank you so much for joining us for Facilitator Orientation for the Year 2 Interprofessional Learning and Learning Activity that will be taking place next Friday, September 15th, 2023. I'd like to start off by acknowledging the traditional territories where we all are today. That University of Manitoba the building, at least the edifice, sits on Treaty 1 territory, which we now refer to as Winnipeg, but that the University of Manitoba has relations and activities throughout what we now refer to as Manitoba, the traditional homelands of the Cree, the Anishinaabe, the Ojibwe Cree, the Dene, the Dakota peoples, and the homeland of the Métis Nation, as well as our Inuit relations up just above the Manitoba-Nunavut border, where we also have activities at the University of Manitoba. And I think in the context of why we're meeting today, to thinking about when we talk about collaboration, we mean between healthcare providers or team members of the healthcare team, but we mustn't forget ever that primary person why we're together is the individual who's seeking care, but that particularly in Indigenous relations, that the community is just as important. So when we're thinking about collaboration, we're not just thinking about collaboration between healthcare providers, but also collaboration with the people that we serve, the communities that form part of the circle of care that individuals turn to help navigate the system and to help them achieve a healthy and healthful wellness wherever they may find themselves. So bearing that in mind. So interprofessional education, why do we do it? We do it for interprofessional collaboration. We've been delivering IPE in this platform in the Rady Faculty of Health Sciences since 2016, which includes 5 colleges. The college, the Dr. Max, no, Dr. Oh my goodness, Gerald Nisnik. College of Dentistry and School of Dental Hygiene, the Max Rady College of Medicine, which also includes the Physician Assistant Program, College of Nursing, College of Pharmacy, and the College of Rehabilitation Sciences. We have 10 programs across 4 campuses that have participated historically in our activities. 4 campuses, including Thompson, Napaw, Bannatyne, and Fort Garry campuses. And our education has from the outset been grounded in theory, specifically the theoretical framework for what it takes to collaborate interprofessionally, the 6 competency domains. And you can see on this slide here, the 6 competencies that are listed on the left. We have focused in on the first 3 in year 1, and we focus in on the latter 2 in the year 2 activities that we're going to be approaching on September 15th. And just an FYI, this framework is being updated, so you can anticipate changes coming in the coming year. Collaboration in practice, why do we do this? The Institute for Health Improvement in the United States, they published in 2007 the triple aims suggesting that to improve our health system, we need to focus on improving patient experiences, bettering outcomes while lowering costs. In the quadruple aim, 7 years later in 2014, there was a focus on making sure that clinicians are supported in practice, and that includes from their team members, from systems and structures, but that clinician well-being is critical to being able to collaborate in practice and for improving our healthcare systems. And then most recently, there's been a focus on health equity, recognizing that if we can address issues around health equity, systems of oppression and racism, then we'll improve better health for our entire population. And at the same time, we'll be improving the economy when everybody can contribute equally. And Laura, I'm going to pass this. Oh, I did one more little thing up in the corner around the patient safety competencies. One framework that we've added to that has helped us formulate what we want to teach the students in year 2 around patient safety is the theoretical framework that's been provided by the Canadian Patient Safety Institute. Explicitly, they include teamwork and communication as part of their framework. And so there's a lot of overlap between these frameworks that we're mentioning, but they have helped guided us in designing and delivering the curriculum that we are delivering in interprofessional education on interprofessional collaboration. I'm going to pass it over to you, Laura.
So just to give you an idea, and thank you very, very much for being here with us and facilitating the upcoming session. But the overall learning outcomes for year 2, which I think is important for you to be aware of, is that the teams, the interprofessional collaborative learning teams, will be looking at interprofessional collaborative care, defending the interrelationship between those 6 competencies, but very specifically, as Moni mentioned, applying role clarification, collaborative leadership, and interprofessional conflict resolution, and doing so in terms of describing the impact that interprofessional collaboration has on patient safety and quality health, positive impact. As well, again, embedded within this contextually are those patient safety and quality health care outcomes. So those various elements that contribute to safety and quality, applying those elements in a fictional simulation case, which is the case for today, and then really promoting it through interprofessional collaboration. Moni, if you click the slide, that what we want you to know is that all of this is very grounded in the pedagogy around interprofessional education, and that we really try to tap into the students' comprehension, meaningfulness, and manageability, or the no-be-do sort of model of learning. And that in the end, this is how we purposely plan to engage the students in interprofessional collaborative practice for those quintuple aims, and altogether better health. Next slide, please. So in terms of the outline, last year, this student group had journeyed through a interprofessional education series of activities that really focused in on population health and the determinants of health and our roles and responsibilities, respectively, in creating health and healthy settings through interprofessional collaboration. This year, we have a roughly 330 learners, 8 programs participating. So we have reorganized teams. They still will journey as a team as best we can through the next year. So 2 synchronous events, this one in September 15th. Perhaps mark your calendar. We'll be sending out a call for January 19th in 2024. And then following what this session, the synchronous event, is the students will stay engaged in asynchronous and synchronous discussions. As well, then at the end of each term, they will do a written reflection, which is really important and valuable to their own learning, but as well as helps us understand what it is that they value from it. So specific to that year 1 was team functioning, interprofessional communication, community-centered care. But as you see, the arrow travels onward and wraps around. We bring those competencies, we continue to develop them. And then in year 2, we really do focus on role clarification, collaborative leadership, and conflict resolution. So specifically with role clarification, we did develop a document which you will have as facilitators, basically outlining roles and responsibilities specific to the case, the fictional standardized patient that we're seeing today, but in very general way as well, about the 10 different programs within the Rady Faculty of Health Sciences. So you probably yourself will find that document helpful. They are examples only. It's not an exhaustive document. So September 15th. Moni, next slide.
So I'll just add that on September 15th, we're expecting more than 300 students from across 8 different programs in the Rady faculty.
So so you know what, back up that slide. So while we have that slide, it's important to realize that because the program sizes are different in terms of number, like medicine has, considerably more students than others, the teams that we have created, which I'm sure you can appreciate was quite the task, may have 3 or 4 med students who will represent themselves, but as well collectively represent medicine. They will always have one of the 2 oral health professions, either dental hygiene or dentistry, and one of the rehabilitation sciences professions, RT, PT, or OT. Midwifery, obviously there's less numbers, so we try to create teams that had a midwife student or perhaps a physician assistant student. So the teams just are, the demographics of the team reflect the number of size of students in each of the programs.
And Laura,
Right,
sorry,
yes.
It may be good to just also note, I don't know if you said it, we have social work in this cohort as well.
We do.
And so there won't be a social worker on every team, because I believe, Moni, correct me if I'm wrong, there's about 15 or so.
Not enough per each team. You're right.
Exactly, yeah. But some teams will be graced with a social worker, which will be a really great perspective when we talk about what the activity will be, to have that perspective in the group, but not every group will get it. And the other thing important to note with the year 2 cohort, like we said, we shuffled up the teams. So the students may be a little surprised initially that their team is different, but what we did do is we tried to take 2 teams and simply add them together. So there should be maybe 1 or 2 faces that they recognize. But when we recreated the groups for year 2, we were trying to keep as many people together that were together in year 1 and added 2 groups together. So that
somewhat
gives some
successfully.
context.
So not participating this year is nursing and occupational therapy, correct?
Correct. And respiratory therapy is actually not participating in year 2.
You might hear from the students where are the other, they might expect to have a nursing student. They're just not able to participate this year. So our next slide then. So then very focused on the learning objectives for September 15th is that they will, in that context of teamwork for patient safety, explore communication tools to better their team function to ensure patient, client, family, community voice. Very specifically, the tool that we are really exposing them to is a meeting, a team meeting, a purposeful team meeting. Ask about professional practice, competency, roles, and responsibilities among team members, and then share that responsibility, creating a positive outcome. And this will be very important with your role as facilitators. So if you click the slide, Moni, importantly, the whole event is a simulation. So we're kind of carrying this theme here along for you about, we're taking, we're using the movie scene, right? It's a simulation, the whole thing. The team meeting is a simulation, and then the team prepares to meet a patient. That's a simulation. And the team actually then meets a standardized patient, our actor, Alex Parker. And so there are, we've sort of organized this presentation as scene 1, scene 2, scene 3. So hopefully you'll have some fun with this. So next slide, please. So in terms of showtime and simulating this interprofessional team, so when the students come and they know this, that they're coming, that they'll be coming and simulating an access team, a team at an access clinic. So that's the basic set. So for your role, your facilitator should already be in the room well before 3. We do let the students know to come anytime after 2:50. So they might, slowly begin to arrive on set, but we only have them for the 2 hours. It's pretty protected time. And so we really do need to get going by 3 o'clock. And importantly, as Linnea said, there will be maybe new team members. They may not know each other. So that first part of getting settled in between 3 and 3:10 is really introductions and icebreakers. And you will see in the facilitator guide, we've, and Moni probably will explain a little bit more, we've got some prompts for some ideas around icebreakers. You're certainly welcome to use your own. Just be mindful of the 10-minute time period. So the first scene of 3 scenes, the first scene is about the team very purposely having a discussion to clarify the concept of person-centered care. They're really concerned and worried about team functioning and the patients, their clients, community actually understanding that, that they are the focus of their care. So they take time to decide and think about, well, what do you mean by person-centered care? And so that's seen as a really valuable activity. And then the next one is team function. So they will mind map basically and visually conceptualize what that looks like, person-centered care, looking for similarities and differences. And we've got a slide to really outline that. Scene 2, so from 3:30 to 3:50, the team prepares for a meeting with the actor, patient Alex Parker. So that is based on what they just talked about in terms of person-centered care and their mind map. So they really are going to here apply it, their main key points to how they will interact with Alex Parker. Bit of a break if time permits, 10 minutes ideally, but if it has to be a little bit less, that's fine as well. Then scene 3, they come back and they are welcoming patient Alex Parker into the room. And your role here is just to be there for them if they turn to you and facilitate that interaction. At 4:15, they will do from 4 to 4:15, so full 15 minutes. We stress full 15 minutes. they will be with Alex. So when there's silence and people look like they don't know what to do, your role would be to give them a prompt, and it could be anything that you think you would do at that moment. And then from 4:15 to 4:35, the patient Alex, as part of the team, will debrief with the team, basically providing our learners some feedback. And then we'll do a bit of a wrap up and evaluation, which we'll describe a bit later, between 4:35 and 4:50. We will stick around and provide a facilitator debrief for all of us at 5 o'clock in the Apotex or the Pharmacy College.
You don't have
Okay,
to
next.
come, but it's an opportunity for you
Mhm.
to give us some immediate feedback. And we usually need to debrief amongst ourselves anyway, and we'd love to have you join us.
Mhm. So in terms of the welcome and introduction, that first 10 minutes, we made a big decision not to use PowerPoints in that room. So the rooms will be scattered throughout the Bannatyne campus. You'll be in one room with one group of students. Maybe we might need you to have sort of facilitate two rooms so they'd be side by side. But we're not using a PowerPoint. You have the game sheet. They have an outline as well. Their outline is accessible to them to you and UM Learn. But your role will be to pass around an attendance sheet. We will have a package ready for you in the room. There will be that hard copy attendance sheet in there. We also will have in the room for you either large post-its, or we'll know that there's a whiteboard in the room, and we will have the appropriate markers for you already in your room. We will let you know what room that will be next week. So you're going to pass around the attendance sheet. It is mandatory for all students to be present. So once we get that sheet moving around, then it's that opportunity for people to share who they are in their program and where they're coming from, and some ideas here around an icebreaker. Share one stereotype about your own profession and how that stereotype makes you feel. Something you're curious about regarding teamwork, or what's your morning beverage of choice and why, if you want to keep it much more lighter. Name something you did this summer, or I've used this one. Do you prefer to be in, on, or beside a large body of water? It's kind of interesting where people end up with, but it's just to, create that icebreaker opportunity. Ground rules. Ground rules here about, interprofessional collaboration and teamwork, about being open and fair-minded. So recognize, acknowledge, no blame, the integrity, and we create this safe place for our learners. Trust, respect individual experience, and humility. Share the air, knowing that everybody in the room are not experts and ask for help. Really, it is about learning with, from, and about each other, and for, the purpose of team functioning and excellence in care. So in doing so, really, we need to really promote differing viewpoints, like create that safe space to allow for differing viewpoints. And importantly, the evidence base in around interprofessional education really stresses that it's not about having a debate. It's about sharing.
And these ground rules are also in the facilitator guide for you.
Mm-hmm. Okay, so I'll introduce the scene one. So now we're on set. We're all in the room. The students have done their introduction, icebreakers taken place, and now they're ready. So in scene one, it's very specific about the team discussing person-centered care and team function aimed at enhancing patient safety and quality of care. So next slide. The team has this on Learn, so hopefully they've read it, but you probably will want to set the stage as well as facilitators. So remind them what's going on. So you can even just read the script again. This is also in the facilitator guide, word for word. So you're a team working at a local access center. The staff wish to enhance their teamwork to better the experiences, workers' experience, systems efficiencies, outcomes, while addressing the health equity. Really in that italics is, that's the quintuple aim. I would stress that. That's the quintuple aim. The team decides that they need a better understanding of how each individual healthcare provider approaches patient-centered care from the lens of their own profession. That's rule clarification, patient-centered care. Without this understanding, it can sometimes lead to disagreements, role confusion, and overlap between team members, which can lead to interprofessional team conflict. So you see how we're bringing in those competency domains right into the scenario. It may be the reason that some patients complain that they're being asked the same questions by different team members. Don't you guys ever talk to each other? Team communication. So the team collectively agrees, that's a collaborative leadership, to spend some time doing a team building exercise or team functioning and share the personal approaches to interviewing a person, presenting in their clinical setting, presenting concern, their goals, the relevant history, and their living situation. So 20 minutes for this activity. That's the scene, that's the scenario. Mind mapping, the activity itself is, maybe you think of it as this concept mapping, but it really is a very purposely visual activity. So it's really appeals to the, well, not just the visual learner, but everyone. It's like thinking out loud and really creating it on a piece of paper. So the post-it, the large post-its, or the whiteboard. So it's pretty important here for the students to do this. So, somebody needs to step up. You really encourage that. Perhaps it'll be you, because the students would like to be, more engaged with the actual throwing around of ideas. But it really is about collating the ideas in a visual format, a mind map. And the focus is here to illustrate those commonalities and diverse means of how they understand the patient client from a client's perspective. And so you're looking for diversity. So maybe in this your choice color code, maybe the medicine's one color, dental hygiene's another color, maybe in that way. But you just sort of trying to create this interrelationship, interconnection, and it could be a Venn diagram. So it's however they choose to create that mind map. So you're the facilitator is just to remind the learners to really share what they know and listen to what others know, and that being humble and curious, and that they are in their second year of their program. For some, that's their senior years. For others, it's mid curriculum. So just wherever you're at, they don't have to be experts on what their profession's all about, right? So what do they know about their own profession? What do they know about others? And then that curiosity. And that's where we create that safe space. That's when the curiosity really starts to flow. So we do provide you with learner prompts for this mind mapping activity, again, in the facilitator guide. So I think you'll find those prompts handy to have beside you.
And Laura, do you mind, I was just gonna jump in quickly in terms of when we were thinking about this activity. So I'm a pharmacist. I'm the pharmacy lead for OIPC. I didn't introduce myself yet, but my name's Linnea, and I just wanted to say that different processes, and maybe even getting them to say, well, what has your process been that you've been introduced from your specific profession, in terms of, I know from pharmacy, we get them to look at when they're talking to a patient, they go through something called Scholar. So we have that in the facilitator guide, but we have them focus on the symptoms, the characteristics of those symptoms, the history, onset, location, aggravating and relieving factors. So there's kind of, some programs may have algorithms that they follow. And so we really want the students to talk about what they've been taught for how they interview a patient and how they really get to know their patients, to see the differences, but also really to see the similarities, and how, kind of like what Laura mentioned on that previous slide, we may be asking the same questions, but we may be asking it in slightly different ways, because the lens that we're asking it through, we're trying to identify a certain, therapy or problem that may arise, or just get to know that patient. And we're hoping that they see there's overlap, but differences, and they kind of figure out how they could bring that all together and interview a patient together, where they get all that information. Everyone gets the information they need from their own profession, but that the patient's also respected in that way.
Linnea, you have humbled me. I can't believe that we didn't introduce ourselves. We jumped right in.
I know.
I'm so embarrassed. So my name is Moni Frick, and I'm with the Department of Physical Therapy, and I'm the lead for the College of Rehab Sciences. And I'll just say, one of the things I really like about this activity, which we've never done before, is we're trying to develop a trust between the healthcare members, between the healthcare providers, that we can trust one another in getting the information we need, so that we don't have to ask the patients the same questions over and over and over again. Laura, would you like to introduce yourself?
I know when you said Linnea, I know I don't think I introduced myself either. Laura MacDonald, and I'm the college lead for dentistry and dental hygiene with the Office of Interprofessional Collaboration.
And we also have Ladan here.
And Catherine. Mhm.
Know if
Ladan, would you like to introduce yourself?
Yes, certainly. Ladan Protege, I'm instructor at the College of Nursing and College of Nursing lead at the OIPC.
Mhm.
Excellent. And Catherine Plouffe, who we couldn't work without, she's here as well. Catherine, would you like to say hello if you're still here?
Yes, hello there. Hi, I'm still here. Sorry. Yes, my name is Catherine, and you'll be receiving all the emails from me. I'm administrative support for the OIPC.
So I'm so sorry that we didn't introduce ourselves at the beginning. We're on a mission, it seems. Okay, so I think now we are going to.
Tony, I should introduce myself too.
Well, if nobody's introduced themselves, everybody. Okay, does everybody want to introduce themselves?
Well, didn't we just do that?
No, those were just the leaders of the OIPC.
Oh, right. I don't need to introduce myself.
Because if we were
Well,
all in a
hello,
group
Mark.
together, we would be introducing ourselves. Let's leave that till the end, okay? We'll see how we're doing for time. But thank you, Dr. Garrett, my department head from the Department of Physical Therapy. But in the interest of time, we'll just go through this right now. This is now getting into the next scene, the way Laura has framed this, for the simulation activity. So we're a team of people in an access center. Now we're going to prepare to meet the patient, Alex Parker, building on the mind map activity that we just did. So the learners are told this in advance. This is the STEM, as we refer to in simulation. This is the fictional case of our fictional patient, Alex Parker. You're working in an interprofessional primary healthcare clinic. Your preceptor or supervisor has asked your team to go and meet Alex Parker and take a history. The vital signs are there, so nobody needs to take vital signs. Alex has requested this appointment because of a persistent cough, fatigue, and bad breath. The learners are advised not to do a physical assessment. This is taking an interview only. And I think it's worthwhile mentioning here that out of the 8 programs who are participating, some of the learners have actually had clinical experiences already, but some have not. The med students, for example, have not yet had any clinical exposure, while the physiotherapy students have had lots of exposure, as have the oral health students. So every program is a little bit different, and their comfort level with this will be different. So your job again, so helping to facilitate the small group to prepare before Alex Parker joins the room. We used to do this online in advance. Students requested very loudly that they be given the time then and there right before Alex Parker joins them. So building on the previous activity, what do the learners want to ask Alex? How can they prepare a list of questions together? Then who's going to ask the questions and why? So it can be any of the professions. It doesn't need to be one designated profession, but when they make that choice or that decision, how are they going to rationalize who should ask the questions? They should decide on more than one person to ask the questions. So 2 or 3 people, but they should be from different professional programs. For example, they shouldn't be, since we have the most medical students in all these teams, they shouldn't be all the medical students, for example. But there's room for everybody, and we know from the literature that everybody learns from this process, even when they're not the ones asking the questions. So there should be someone who's a timekeeper, someone can take notes, and somebody needs, at least one person needs to be the dedicated observer. The observer is provided with the simulation team debrief form. It will be available to the students online in advance, but a hard copy will be provided in your folder in the room so that we can minimize the students pulling out their laptops. We want them to attend to the activity and not worry about what's on their laptops. So we'll have a hard copy, probably 2 hard copies of the simulation team debrief form so that people can follow along. And the team debrief form, what they're looking for, it's been framed in the collaboration competencies. So then we move on to scene 3, the actual simulation itself. The person playing Alex Parker will be waiting outside your room just before 4 o'clock. So following the patient interview, and in the facilitator guide, it also says, where will Alex sit? Make sure you have a designated spot where Alex Parker is intended to sit when they enter the room. So as soon as the group is ready, they can go to the hall and somebody should bring in Alex Parker and welcome them. Alex Parker, incidentally, may be somebody who appears as a woman. It may be somebody who appears as a man. They may prefer she or he pronouns or they pronouns. We're not quite sure. It's a variety of actors who are playing the part. And Alex Parker is somebody in their 60s, by the way. So now they do the actual interview of Alex. So they have 15 minutes. So I already mentioned this, that Alex will be waiting outside the room, invite them in. Alex should only respond to the questions asked. Alex has been prompted not to go off on long tangents. They have lots of things to say if they're asked. The learners don't receive all these detailed answers, but there will be one copy of Alex's script actually in the folder for you as the facilitator, so you know what to expect. We're also going to share that with you in advance, so you can take a look at it in advance. One thing that we have found in the past is that students sometimes need to stop and regroup. Because it's simulation, this is meant to be a psychologically safe environment. It's meant to be a place where you can make mistakes, not be embarrassed. So if somebody needs to take a time out, that's absolutely fine. Time out, and the team can reconvene and then start again. And so make sure that you tell them that in advance, that they're allowed to take a time out, ask for help if they need it. The other thing is that we've also experienced in the past that some of the teams, they rush, and they might be finished in 5 minutes. They have a full 15 minutes with Alex. Alex is not moving on to any other team. That Alex is designated for your team only. So they have a full 15 minutes. They should get to know Alex. Now we don't have enough facilitators for all the groups that we're organizing. So we are having some large rooms where there'll be multiple Alexes coming into the room. Don't be surprised by that when there's a bunch of Alexes hanging out in the hall. And then when they come into, there'll be more than one in one room, depending on the size of the room. If you're assigned to a tutorial small group room that only has room for 12 people or 8 people, you will only have one Alex in your room, not to worry about that.
Each team will have one Alex.
Yes, absolutely. And following the simulation, it isn't simulation without the debrief. Debrief is considered critical when you're doing simulation activities. If we had more time, the debrief would be even longer. Typically, debrief sessions are longer than the actual simulation. So we have invited Alex as the patient, the actor playing the part of Alex, to remain in the room for at least 5 minutes to give general feedback on how the team made Alex feel. Did the team make Alex feel like they were listened to and heard? What did they think how it went? Now, the person playing Alex is a trained, standardized actor. They know how to give learners feedback. They should be able to do this quite easily without you having to intervene, but you might just need to facilitate and say, okay, Alex, how do you think that went from your perspective? Now, Alex has been, team debrief. Somebody wrote 10 minutes there. It's supposed to be 15 minutes. That's an error. Team debrief, they have another 15 minutes so that it adds up to a total of 20 minutes. And the team debrief, the student who's been assigned as the observer should lead the discussion using the simulation team debrief form. That being said, we have also provided you with another framework referred to as the PEARLS framework. And the kinds of questions and the way it's set up are in the subsequent slides, but it's provided in Appendix B of the Facilitator Guide. It ultimately ends with what worked well and what did not work so well. What would you do next time to improve the quality of the encounter, or in this case, the interview? So a couple notes about debriefing. Remember, debriefing is not an opportunity for us to lecture. It's meant to promote critical thinking. We really need to pay attention to allow observers to actively engage in the debrief. Certainly, if there's time, feel free to share your own brief experience around team interviewing. Students love it when we bring their own experiences to these activities. Do have courageous conversations. It's okay to make yourself feel vulnerable. It's okay for students to feel vulnerable. If your debriefing ends really quickly and you don't know how else to prompt it, think outside the box. How would this be different if this were happening? If this were happening in a different practice setting? Prompt the students to think how things could or might be different. So it's okay that we role model that we can be vulnerable and that it's okay to take risks. That's important. So the PEARLS framework, Typically, when the Pearls framework begins as the facilitator, they start by setting the scene. It's consistent with our simulation kind of approach to this, that we'll spend about 15 minutes debriefing the case. So this is in quotation marks. First, you'd be interested to hear how you're feeling now that the scenario is over. Second, you'd like someone to describe what the case was about to make sure we're all on the same page. Then we'll explore the aspects of the case that worked well for you and those you would manage differently and why. I'd be keen to hear what was going through your minds at various points in time. We'll end by summarizing some take-home points and how to apply them in your clinical practice. So that doesn't quite make sense if the student observer is leading the original debrief, but this is how the Pearls framework sets it up. So you might want to modify some of that if you're stepping in or starting it off and saying that you're going to hear from the observer first. The Pearls framework then moves on to reaction and description. The reaction refers to what are general impressions and how it went, and prompts, how are you feeling? How are the rest of you feeling? And again, really pushing a little bit. Did you feel like you had the chance to ask questions? Did you feel like you were engaged? And then the description, you can ask somebody from the group to summarize the case from a team-based point of view so that everyone's on the same page. You might say, from your perspective, what were the main issues you had to deal with? Then the Pearls framework moves on to the analysis of the scenario. It signals the transition to the analysis, as I just mentioned. Now that we're clear about what happened, let's talk more about the case. I think there were aspects you managed effectively and others that seem more challenging. I'd like to explore each of these with you. And then it moves on to a learner self-assessment, what worked well, what didn't work so well. What would you do next time to improve the quality? And then in summary, are there any outstanding issues before you close? And you can either guide it by summarizing, or you can ask the learners to guide it. So by having the observers actually follow their own simulation debrief form, we're trying to set the stage that they can be collaborative leaders in trying to help the team move forward. The Pearls framework provides you as the facilitator an opportunity for another way of debriefing. If the other approach goes sideways, it gives you a way to intervene, provides you a framework to move through it. Ideally, the students are doing the debriefing. You can fill these questions in if you feel like it's necessary for the nature of the conversation and how it's unrolling. Laura, do you have anything to add to that, or Vladan or Linnea, before we move on?
I did want to say one thing, because are we sharing the script of Alex Parker with our facilitators? Because
Yes,
We are.
There's quite a lengthy script. And the one thing I want to highlight is that I'm sure from when you're reading it from whatever profession you come from, you're probably thinking of, solutions or problems, or start in your mind care planning for Alex Parker. But that is not the goal of this. So we don't expect the students to be coming up with a solution to these problems that he's presenting with. The focus really is on the team function, the team communication, and how they decide to go about interviewing this patient. And so just to highlight, if you feel, oh, there's, a lot of, or something I wouldn't understand about a medication, and you're coming from a different profession than, say, pharmacy, that is not the intent of this. So we don't want them to be solving the case, but we want the focus to be on the interprofessional aspect of it, the communication, the team functioning. So I just wanted to make that clear, because I think it could be overwhelming looking at that script, feeling like you have to know the answer to what's happening with Alex Parker. And also telling the students that's not the point of this. The point of this is to see, how did you communicate with a patient, and was that successful?
Those are excellent points, Linnea, because we don't want the students to start saying, well, what kind of tests would they order now for this individual? That's not the point. It might get into a little bit of the activity, but that's not the focus.
right. And even if they did go in that direction, then the curiosity of the others would hopefully prompt, like, well, what would that test do? Why would you go that avenue, right? It is truly about understanding the story of Alex as much as they can understand from the questions they ask, and prompts that Alex would hopefully also help the student ask, but as well any peripheral activity, right? Understanding team functioning. So I don't, I don't understand what that word is, or that acronym that you just used is. What is that? That's all about communication. right? So that I would really let that happen. But again, not about, you know, arriving at a diagnosis or a care plan. That's not the intent.
I saw
Madame, were you going to say
Yeah.
something?
I would say our intent is guided by our student learning outcomes. So if unsure, look at what the outcome of the session is. Time is precious. We want to achieve something, and the outcomes does not say be a clinician, diagnosed, and pick the brain of other professions what they would do. Clear is the team functioning, collaboration, respect, trust, and all of these things. So kind of if in doubt, just refer to the outcomes, and they should act as guides.
Yes, perfect. So in terms of the wrap up and the evaluation, which will be the last little bit of the session, in the next slide there, Moni, is that in your role as facilitator, you're going to take this opportunity. You have had a debrief with them around Alex Parker, but now we're stepping back to those bigger pictures, returning to the learning objectives of the entire session. So what did everybody learn with, from, and about another learner, right? All for that interprofessional collaboration. And to remind them in that wrap up around what they learned with, from, and about each other, and for is those 6 competencies. So bring those forward as well. And how does everyone think about them now individually and then perhaps even collectively? So we'll spend some time there. And then next slide, Moni, is your role to help them, remind them as you're wrapping up for someone to take a picture of the mind map. Because if let's say, for example, somebody from the team is absent due to illness, that they would be able to share this mind map. They all could take a picture of the mind map. We are not asking them to submit it, but we will collect the mind maps if they've done it on the Post-its, because or I guess I'd take a screenshot of or a picture of the whiteboard as well. So, and that's really just to see what were they thinking and talking about. So someone should take a picture. They're not submitting it onto Learn, but then remind them that there will be 2 discussions that will follow this September 15th event. One will be synchronous, one will be asynchronous, and that they will have a written reflection due in the end of November. That's just a reminder for you, for them. We certainly will be touching base with them several times. So if you forget to do that, no worries. We'll be touching base with the students. And that we are going to meet again with them in January. And just to be true to students' responses, probably 50-50 split of students would like to get together in person, or they'd like to do it via Zoom. So our January event will be virtually delivered. Maybe keep that in mind as you think about whether you'd like to participate again with us as facilitators. So in that folder that we will have in the room for you, put the attendance sheet back in there. The completed simulation team brief, that observer team brief form, that can go back in there as well. The facilitator guide, well, you probably could take that with you. We don't need it back. And any markers or that we left behind, just if you could leave that in the markers. Yes, so Kelly's asking this question. To confirm, the debrief is meant to be led by the observer team member with a facilitator input. Yes, correct. So the wrap up is a bit different than the debrief, right? The wrap up is taking a big step back. The debrief, there is a debrief with the Alex Parker, and then the debrief based on the student that was sort of given responsibility to sort of be an observer. They've got some, prompts there that they can sort of look for in the team. But you too will facilitate that debrief if you're finding the students are struggling with it. So, yeah. And
Vlad, you had your hand up?
Yes, I'm just wondering, following this activity, what are we asking the learners to do? Are these 2 synchronous and asynchronous activities related to the activity?
Historically, we have not made it directly related, but building on it, because there are some learners, for example, the 2nd-year PA students are in clinical. Some of them can attend and some can't because it's in person. So we want to make sure that the learners are not disadvantaged if they're not able to attend because they have clinical responsibilities. So it will build on it, but we can't make it directly related. We've learned that over the past.
Yeah, I totally understand. The reason I'm asking if we really want to make it a enhanced learning and make it pedagogically valid, it seemed to me that unpicking and unpacking the experience, which is what debrief does, it would provide a gold mine for learning for students if they had access to their peers' comments. And they could be anonymous, they could be collated, but if they're discussing something, having that experiences explicitly stated, it would help them when they log into their group, say, oh, I never thought this perspective, this is really valuable, this is what I can take away. What did I take away? And then post that, and then having those collective experience shared, I think that is what it's all about, because then you going unpicking this, how the other professions think, how would they approach situation, how would they deal, and what did we do wrong, and also feedback from the standardized patients extremely valuable. So kind of thinking, reflecting on that, and it's pretty difficult to use AI for those kind of a experience that learners went through. They probably could, but it's much more difficult. So just something to consider.
Well, if you want, Moni, if you want to go back to that slide showing the outline of the timelines, are year 1, year 2, way back in the beginning there. So the students in this session here, again, based on student feedback and facilitator feedback, this is why we think it's really important for that visual mapping, right? So the students take a picture, that there's we have the observation form for the team to have and to use for debriefing purposes, and for the quality of the time spent with Alex and with the debriefing. So not shortchanging the debrief, and really encouraging the students to really sit there and absorb those key points. So in those asynchronous and synchronous discussions, they will carry forward and we will weave them into those sessions as well, in particular with the reflection. And we often will take that and look at a basic thematic analysis, and through our announcement page on Learn with the Learners, we start to bring forward those major themes of where people have been really emphasizing was really valuable and important. So it's really really valuable, the whole reflection piece.
I'm going to add at the end, I wasn't quite done with the wrap up. There was this where we were, then evaluation. There is a survey that we want the learners to do, and we've often sent this to them after the event, but depending on your timing, we'd really prefer they do it right then and there, because otherwise the response rates are always really poor. So we decided to save on paper though, and not do the survey on paper. So it's easy to be able to tell them what this is. Go to SurveyMonkey, and the code for the survey is Alex Parker 2023. One word, no spaces. Alex and Parker are both capitalized. So we'll follow up with the survey link for students who afterwards as well, with an email saying that if you didn't have a chance to do the survey, here it is. But if you're running on time, and if you can have the learners do this survey while they're still with you, that would be ideal. And the survey shouldn't take more than 10 minutes, maybe 5 minutes. Well, actually, but usually they take about 2 to 3 minutes. The average time is 2 minutes. So they shouldn't be missing the bus because of this survey. On the next slide, the students have some work they need to do in advance of next Friday. They've been told about this. They need to watch a module on role clarification. They need to have read this one little paragraph about Alex Parker. They've been provided the roles and responsibilities document on what the various health professions see their own roles and responsibilities as an overview when it comes to someone who presents with a chronic cough, fatigue, and bad breath. There are some additional session resources for the learners. A virtual interprofessional chronic cough clinic that was produced, that was published 2021, and a joint position statement on the role of health professions in smoking cessation. Yes, Alex Parker smokes. That probably doesn't surprise you. We have also providing you with a few extra facilitator resources. We've mentioned this already. You will get the detailed script that was provided to the standardized patient or actor. Dr. Nicole Harder, our Mindemar Professor in Human Simulation in the College of Nursing. She's done a variety of workshops on how to debrief in facilitation. And during COVID, these became online workshops, and we are very fortunate to have the recordings available. So if you're interested in simulation and you've never done this before, if you're a little bit nervous about debriefing, I would highly encourage you to check out those debriefing recordings. And then the standards committee that Nicole Harder is also a part of, they have also come out with standards for debriefing and simulation enhanced IPE. So those are just extra if you wish. Reading the script for standardized patient Alex Parker, excellent idea. And I think we've got 7 minutes to go. That closes this. I'm going to stop sharing and I'm going to stop recording. And well, actually, I'll see if there's any questions before we stop recording. It'd be nice to have those questions if you're willing to be in the recording as well. And feel free to just unmute yourself and speak up if you have a question. You can always follow up by email, or you can put it in the chat function. And I think everybody who is here today has facilitated previously. They have either facilitated with the Office of Interprofessional Collaboration, or they facilitated within their own programs. So we've got a wealth of experience and expertise here in teaching and facilitating. So we're really grateful to you for that. So I will push stop.